You can't just watch TV all the time. How do you inspire children to and adults and older people to exercise more?
As we are discussing women health and
Closing remarks?
Thank you, ma'am, Kapil sir, Dr. Bartla, Kiran ma'am.
The whole, I'm talking about you at this point of time. I'll come back to Shelley, who I don't call out. Though she should be called that also. Harsh.
And a warm welcome to all of you. Mrs. Dr. Malika Nadaji, President of the Special Olympic Bharat, a philanthropist, social worker, doing so much in rural Mr. Kapil Dev, the legendary cricketer. There is not another one like him today. And the founder, chairman of Kushi Foundation, again doing a lot of work for the upliftment of women in India. Our very own dear friend Kapil Dev, Dr. Head of All India Medical Institute, doing a lot of work and research in gynae in the oncology department. Welcome here, Nirja. Thank you for being our major support through all our years of work. Thank you so much. You've been a great friend. Of the Vashisht Nagrik Kesari Club, Director of Punjab Kesari, as you all know, and my very own sister. Thank you, Kiran. Ms. Gunjita Dhawan, a true hero in any words that you may want to say, a cancer warrior and an inspiration for millions of women today, worldwide. Gunjita, thank you so much. The image guru, the communications expert with keen interest in wellness and preventive health, Dilip Cherian. Thank you, Dilip, for accepting to be the moderator. Thank you so much. Friends from media, thanks for coming, and again a warm welcome. You know, we are celebrating women today and me, and so we believe that their mental and physical well-being is of utmost importance.
That make sure that Dr. Mahajan and Shelley keep a tight ship, and that all of us are here almost on time to make sure that we contribute and play our little role in being part of Mahajan Imaging's We for Her initiative. And what I'm going to try and do is help all of us focus on how the kinds of issues that women face in their health life. We spoke of mental health, but for the moment we're going to talk about the physics and the physical health, because in many cases, while imaging and genetics may help you treat and deal with other issues, the focus at the moment at this We for Her panel is on Women's Day, women's health, and I'm so happy that we have a panel of people who can address this. And I'm going to go round the table very quickly, ask basic questions, Hindi mein ya English mein, as you please, you can speak. And most of it, कोशिश यही होगा कि whatever we say has a resonance and use. I'm a great believer that we must only say the things which are of use to others, so that they can learn from it and they can put it into practice. नहीं तो हम बोलते रहेंगे और कुछ सुनेगा नहीं। दो चीजें हैं जो मुझे फोकस में है। एक तो women who are specially abled and who want to spend time on achieving physical, shall we say, targets or goals, which otherwise many of them may not. That's one. And how much do you see this playing out in the rural areas? हम सब cities के बारे में बात करते हैं, पर आपका काम शहर से बाहर भी बहुत काफी होता है. तो टेस्टिंग जो है, do you see this as something that women are willing and their families are willing to invest money in, ताकि प्रिवेंशन हो जाए, या जब कोई प्रॉब्लम है उसका टेस्ट से इलाज सही हो जाए?
Thank you very much, Dilip ji, for the question, and thank you for inviting me in this program, We for Her, the initiative that has been taken by the Mahajan Imaging and Labs. And I would like to welcome each and every panelist who are here today to celebrate the power of women. We generally call it women empowerment, but I think we all are, who are sitting here, are powerhouse, as mentioned by Dilip ji. So we are here to celebrate Women's Day and the power of women. And here we are talking about the health and mental well-being of the women of our country. I would like to speak on the disability sector, as you have mentioned, as I'm working with the disability sector, that is specially abled and specially abled intellectually challenged sector. So I come across a lot of issues and problems related to women and health, and also the disabled women. So when we talk about women and health and general empowerment of women, I would like to highlight 5S, that is Swasth, Shiksha, Samman, Sanskar or Suraksha. These are the 5 issues which we need to discuss, we need to address. If we want to see our women empowered, if we want to see our women as Shaktishali Nari of our country, and when we talk about the disability sector, this is one of the most neglected sector, I think, and women with disability is another important area where we all need to work. Women in the rural areas have different issues related to health, and awareness is very important in rural areas, especially today when we are coming across a lot of issues with cancer, and especially breast cancer and cervical cancer, which we are facing. Also issues with kidney, where we had never heard of women facing issues and kidney transplant. But in rural areas, we come across cases where there are many issues with which is related to kidney and transplant. So I think it is very important to discuss the situation of women, and especially I would focus that we all do something for the disability sector and women with disability.
Thank you. Or whatever else you want to discuss.
Thank you for your question, and I would also say thank you for the invitation to have me here on this panel. It's really a powerful initiative, We for Her, and indeed, as Malika ji was talking about breast and cervical cancer, set the stage very nicely. You know, women in general have been preoccupied, as was mentioned by Ritu ji also, and have only focused on symptoms. And curative intent has not only been with the patient herself, but also with hospitals, who are so preoccupied with the burden of patients that preventive care takes a backseat. But now cancer is increasing exponentially. There's not a single family I know who doesn't have some member with some form of cancer. It's actually alarming. And there are various reasons, because each cancer has its own. But it is hard to say one test. I don't
I'll let
think-
you say two then.
Yeah, no, because why I say it is that there are a lot of preventable and preventive problems which are interlinked and which also influence the outcome of the other. So in India, if we look at it, our problems of anemia, tuberculosis, diabetes, and cancer are all very much interlinked, not just for the breast and cervical, but also for the endometrial. They impact how the patient will respond if she has a problem. But coming back to the problem that women don't want to know. They say, if I have the big C, they won't utter the cancer word. If I have the big C, I don't want to know about it. But trust me, you do. Because the sooner you catch it, the better is going to be your outcome. The higher are the chances that you will have a real cure. So in cervical cancer, we have also a pre-cancer. So we have luckily an era of molecular diagnostics exploring, and we are now on the verge of having HPV tests that are affordable for cervical cancer, which we are hopeful very soon with Nadaji's influence that we will have even in the rural settings. But for women in the urban settings, certainly we have very good HPV and PAP tests. And for breast cancer, we have mammograms, not in the rural setting at the present time. We are reliant more on clinical breast examination, maybe ultrasounds. But for younger girls, ultrasound, sometimes in familial cancer cases, MRIs, and regular mammograms after the age of 50. And these are the things why in the West, cancer is not such a feared thing. There are women who have a uterine cancer, later they have even a second one, breast cancer. They just go systematically, get them treated, get over one. It's like you had first a flu and then you had something else. So we can actually at least control the cancer and have a good quality of life.
Terrific. The whole, I'm talking about you at this point of time. I'll come back to Shelley, who I don't call doctor. Though she should be called that also. Harsh.
Thank you very much, Dilip, and thank you everyone for being here. You asked a very pertinent question about data-driven healthcare. And frankly, if we look around the world, data, even in the Western countries, is very fragmented. Even if there is a repository of data, the images will not speak to the report, will not speak to the clinical data that is there. They are all lying in silos. And during COVID, there was an attempt at learning from each other, sharing data across geographies, across hospitals, across different hospital systems, and yet we failed because the digital data lies in different kinds of texts, in different kinds of forms. That's where, the government of India has taken a huge initiative, which is on Ayushman Bharat Digital Health Mission, ABDM, where, keeping in mind the fact that currently most of our healthcare data is not digital, just as the government is attempting to build a skeleton of the digital data, the highway, on which all healthcare entities, from government hospitals, private hospitals, our district hospitals, CHCs, PHCs, even the small, single doctor clinics, the diagnostic centers, the ultrasound centers across the country come onto this one digital system, which would be uniform, so that we would have data transportability. Today, someone gets a scan done in Mahajan Imaging and Labs here, and tomorrow he or she is in Bangalore. It would be possible to actually download the data there, and the Aadhaar card, the unique health identity, will also help in this endeavor. This is not going to happen overnight. It will require a lot of hand-holding, a lot of cajoling, a lot of incentivizing, both of the public as well as the private sector, may take 5 years, may even take 10 years. But I think we are already on the path to electronic health records, into having everything digital. It will also take a lot of money, but the government's willing to spend it. And so we look forward to having this data, which would then be able to give you heat maps. Where is it that TB is more prevalent in the country? Where is cervical cancer more prevalent? Where is breast cancer more prevalent? We already know that breast cancer in cities is nearly 70-80% more prevalent than in our rural areas. Though the rural areas, as Malika ji said, are slowly catching up because lifestyle is changing there also. So this data-driven, evidence-based healthcare, evidence-based treatment, evidence-based evidence which we get from diagnostics. And here I would like to talk also about the fact of integrated diagnostics, something which is a word which is coming into its own globally. And we set up this center where we are about 3.5 years ago, where from hemoglobin to next-gen sequencing and from X-ray to PET-CT, everything is being done under one roof so that the patient and the treating physician are able to get a comprehensive diagnosis, not diagnosis which is in silos and then you are struggling to make sense of it. And so I think with the government's help, with the initiative from the private sector, I think we can go forward. And there's so much that can be said. We talk about the health and wellness centers, the Ayushman Arogya Mandirs, 170,000 of them across the length and breadth of the country, which would help in preventive healthcare, but that we can take up later.
Thank you, Harsh and Ritu, inviting me for this beautiful topic and meaningful topic. We really need to discuss about this topic. You rightly asked me, old और senior women जो है उनको कैंसर के बारे में या हेल्थ के बारे में हम क्या एडवाइस कर सकते हैं. As you know, I am working for senior citizens since last 21 years. और दोनों तरह के senior citizens like middle class, upper middle class and needy. उन लोगों को मैं डील करती हूँ जो सारी उम्र बच्चों के लिए, समाज के लिए कुछ करते हैं पर अपने आप को भूल जाते हैं. और कैंसर राइटली सेड इट्स अ बिग नेम और उससे डर लगता है और आजकल वो जुकाम और खांसी की तरह है. पर मैं सबको ये कहती हूँ कि प्रिवेंशन इज बेटर देन क्योर. और अर्ली जब आपको कुछ भी लगता है, जो सीनियर सिटीजन्स हैं उनको बहुत सी प्रॉब्लम होती है लाइक बीपी, शुगर, ऑस्टियोपोरोसिस और ये बहुत सी हार्ट डिजीज है, आंखों के कैटरेक्ट के ऑपरेशन तो होने ही है और सब कुछ होता है. पर जब उनको कैंसर का नाम सुनते हैं तो कैंसर इज लाइक ए हुआ उनके लिए. तो उनको मैं ऐसे डील करती हूँ कि कैंसर आज जुकाम और खांसी की तरह है. आप जाओ, टेस्ट कराओ और मोस्ट ऑफ द टाइम डॉक्टर हर्ष हेल्प मी. इन्होंने मेरे सीनियर सिटीजन के लिए एक फ्री ऑनलाइन सर्विसेज भी स्टार्ट की हुई है, जो मैं उस सबको इनकरेज करती हूँ कि आपका तो कुछ नहीं लगता, आप फ्री जो सर्विस है, फ्री ऑनलाइन सर्विस है, वहाँ पे आप बात कीजिए, पूछिए और बहुत से लोगों को उससे हेल्प भी मिल रही है. क्योंकि एक डर और एक अच्छा डॉक्टर डायग्नोज करने वाला मिलना इट्स वेरी इंपॉर्टेंट. क्योंकि आजकल जो है कि इतना बड़ा हो गया है कि अगर तुम्हें अच्छा डॉक्टर मिल गया, जैसे मैं भी डॉक्टर हूँ, आई एम डॉक्टर मुन्ना भाई MBBS, प्यार से उनकी बात करती हूँ, फिर मैं उनको सिखाती हूँ, बताती हूँ कि जैसे कहते हैं ना कि सब ईट ए एप्पल वंस अ डे एंड कीप डॉक्टर अवे. तो मैं कहती हूँ कि अगर आपने डॉक्टर्स को दूर रखना है तो पहले आपने टेस्ट कराओ. जाकर टेस्ट कराओगे, एक टेस्ट कराओगे तो उससे डॉक्टर आपसे नहीं, आपके तो आना है डायग्नोस्टिक्स सेंटर में, तो आप दूर रख सकोगे. तो कैंसर उनके लिए बहुत बड़ा डर है. कैंसर एक नाम बहुत बड़ा है. एक डायग्नोस्टिक सेंटर में आकर उनको जब मालूम पड़ता है कि इट इज क्योरेबल, इट कैन बी क्योर, तो उनका डर थोड़ा खत्म हो गया.
Got it, thank you. Now कि ये प्रिवेंशन करो, ये टेस्ट करो, जल्दी करो, ताकि you don't have to wait too long.
नमस्कार। मैं यहाँ क्यों बैठा हूँ समझ नहीं आई मुझे। आपकी बातें सुनते हुए थोड़ा सा मेरे को अचंभा सा हो गया कि what I'm doing. I'm not a doctor. I don't know the spelling of doctor, so there is no point I'll talk. But my thought process is totally different.
Yeah, healthy specimen.
Yes, उसके लिए उसी लिए मैं आ रहा हूँ. I think these are the people who can talk about that medical side. I can only talk about the health. If you keep healthy life, that's make all the difference. I think where we have to be awareness should be there कि क्या हमारी औरतों के पास भी क्या anybody who's become a grandparent, do they have a sporting shoes? नहीं है. तो आप कहाँ जा रहे हो? आई थिंक किस चीज की आप बात कर रहे हो? आप मेडिकल की बात कर रहे हो? ये सब आपके पास तभी आते हैं जब वो अपनी एक्सरसाइज या हेल्थ को नहीं देखते. How many people have that? Not even 2% of our country, people plus 50 have walking shoes. I think आप जिस चीज के ऊपर गौर कर रहे हैं उससे कई गुना ज्यादा है कि उनके माइंडसेट चेंज करो कि यार रोटियां नहीं बनानी, बच्चे नहीं पैदा करने. You have to look after yourself, so look after the country. I think we always respect, and like Ritu said, we are celebrating a Women Day. बाबा हम हमेशा ही वुमेन को सेलिब्रेट करते हैं. एक दिन नहीं है. It's not one day. I think women is a very powerful tool we have. I think it's important the recognition what in our country in last 30 years given to the woman is not you can put the number there. We recognize that women have the power, but I think it's more important for us, for the government, for everybody, get into the sports side. I'm a sportsman, so I can talk about sports. I'm not saying कि जाना चाहिए, टेस्ट करवाने चाहिए कि नहीं, पर ग्राउंड में जरूर जाओ. वॉक के लिए चाहे आप 70 years old हो, एटलीस्ट आधा घंटा वॉक तो करो अपनी स्ट्रीट पे. That's more important. If you want to go look for the cure, that is the cure. Not कि हम टेस्ट करवाने से ही हो जाएगा, पर वहां तक पहुंचने के लिए प्लीज लुक आफ्टर योरसेल्फ. आई थिंक हमने इग्नोर किया हुआ है अपनी स्पोर्टिंग साइड. हम एजुकेशन के लिए कह देते हैं. आज अगर किसी को भी बोले कि आपको ट्यूशन के लिए जाना है, सब माँ बाप भेज देंगे. आज उनको बोलो कि आपको खेलने के लिए जाना है, उसके लिए 100 रुपया देना कोई नहीं देगा. So the mindset we have to change in our country. The sports is the only way you can make our country stronger. Yes, rest of the thing you can take care. For my job, as I always say, no, bring the people to the playground. इतने बड़े बड़े स्कूल परमिशन मिल जाती है, बना देते हैं, प्लेग्राउंड है ही नहीं. How is that possible in our country? चाहे वो अर्बन हो या कहीं भी हो, जब आप स्कूल देते हो 40% to 60% should be a playground. If you make that, then the country becomes strong and then your part becomes easier. But if you're not going to look after that side and not talk about that side, then as a sportsman I feel very sorry about that. But I think I must say that you people are doing a great job. As a sports person, I would say it's more important today to look after the health side on this, where you have to walk, you have to eat properly. Awareness is the strength. If you are not aware, you lose everything. You want to say something,
Yes,
please.
I do.
Dr. Bhatla, go ahead.
Thank you so much for that very eye-opening statement.
Yes,
But
it actually broke the script.
But
It is not part of the script at all.
I will tell you कि हम हर मरीज को कहते हैं कि आपने कम से कम 40 minutes का walking जरूर करना है. I don't know if that's good enough in your book.
No, I'm not saying 40 minutes करो यार. Mindset change करो.
उसी से हम बहुत करते हैं ना.
Mindset ही नहीं change करते. खेलना ही नहीं है. आप मैं नहीं कहता खेलना है, वॉक ही कर लो. वॉक ही नहीं करते. नेचुरली कैंसर आएगा. 70 साल में आपने कभी वॉक नहीं किया. I mean, these are the things what our country should be very important. मैं नहीं कहता कि आप मंदिर ना जाओ, आप गुरुद्वारा न जाओ, मस्जिद ना जाओ. 50-60 साल के बाद, रिटायरमेंट के बाद आप उस तरफ देखते हो. And when you look at the European advanced country, after they become grandfather, they go for outside. Let's do some activities. They take their grandchildren कि playground में लेके जाओ, उनको mountain climb. स्विम के लिए लेके जा रहे हैं. हमारे ग्रैंड पेरेंट्स देखते हैं, चलो भाई मंदिर में जय जय करो. No, it's not. I'm being very straight and very honest. Yes, you respect your religion, it's very important, but more important is look after yourself. That's where we should emphasis much stronger than anything else.
सॉरी कपिल,
Go ahead.
हम लोग जो सीनियर सिटीजन को मंदिर, गुरुद्वारे और या मस्जिद में जाने के लिए वो कहते हैं कि जाओ, पर एक्टिविटीज करो. You can imagine they are singer, they are dancing, they are poet, they are actor, they are doing every sort of activities. पर हेल्थ के इशू में फिर भी अपने आप को इग्नोर करते हैं.
Yeah, but
और मैं
90%
हमेशा उनको कहती हूँ कि हेल्थ इज गॉन, everything is gone. If wealth is gone, something is gone. If your wife is gone, your problem is gone. So इस तरह से मोटिवेट करते हैं.
Very highly motivated. Now I'm coming to Gunjita now because amongst us right through it and is an inspiration because of the power of testing and the power of recreating your life through testing times. Gunjita.
First of all, thank you,
Closer to you.
Yeah. First of all, thank you for helping me be a part of a purpose of serving with information that I got through experience. And thank you, Ritu and Dr. Harsh Mahajan, and Be for Her definitely is the way to go. And as everybody here, esteemed, team here has said that it is very important. So I'll start by saying I can share out of experience that yes, early detection is the way to go. The reason I found out we were still in the second phase of COVID, and it was just a little knock, which was in the month of July, which is a rainy season. So my husband included, he said, listen, this could just be a pimple. The weather is so and it's COVID. But because I had a family member who had just gone for the test, and I said no. I paid extra attention to that knot, which was just like a tiny pimple, on my breast. And of course, instantly we fixed up an appointment and went for it. And yes, that was not only, and it was just barely visible. But because of that, not letting it go, like insisting that no, I want to get my go whatever the process is, and spoke to the doctors here also that how to go about it. So we started with mammogram, and then of course I had about 3 of them in my right breast and 1 in the left, and lymph nodes were also affected by it. And yes, but this all was possible because I did not ignore one small health, which is very normal. So all I would say is that you should definitely not ignore, even if it's the smallest cough or cold or a headache, and just go, wait for 3 days. In my case, I didn't even wait for a day. It was a Sunday, and I know Monday I was there by 18th of July. By 1st, I was in surgery. So I had double mastectomy and double reconstruction. It was a process. But yes, it was only possible, and I'm sitting here because of that detection, and with my entire family and friends all standing by me. They never made me feel any less, but here I am because of that detection. And still, it first started with every 3 monthly getting a checkup done. Now I'm down to 6 monthly. Then eventually they go on, by fingers crossed. So yes, in fact, even before I'm due for a checkup, I get on the case of putting in my head that okay, next week I'm going to call the doctor. So you have to be, and I'm not reliant on my husband anymore to do that. I do that myself. And of course, I have this wonderful team here that is available. Some tests I just want to get extra tests for, say, zinc and whatever, magnesium and all, because I want to be proactive, because if I'm healthy, my family will be at peace, my daughter will be at peace. They don't need to worry. So I go with the philosophy that I'm taking care of myself for you. You take care of yourself for me, And one more thing I'll say, which I learned through another doctor, is people say survivor, 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 and we leave it at that. One of my doctors told me, and that was an apt term, why should we be survivors? We should be thriving. Life is meant to thrive in it. And so yeah, dress up, get up, go, but first go out, do whatever you have to, but first go,
get your regular checkups done, and don't ignore even if it's the smallest, tiniest of a headache or a cold or a pain, you know. So that's my contribution to the.
Thank you.
Yeah.
It's partially already begun to be answered in what Harsh said about testing, and you are at the cutting edge of also more than just testing, of research. And since all of us are talking about women, tell us one or two things that you have found about Indian women.
Today, data-driven insights have really revolutionized healthcare by enabling precise, predictive, and personalized treatment strategies. When we talk about what we have found about Indian women in terms of our research on cancer and other diseases also, like cardiovascular or diabetes, the problem I think is that we are still relying on the data which has been provided to us by Caucasian populations. Our problem is that, in fact, I always say that we are sitting on a treasure of data. Being such a heterogeneous country, epidemiologically, socio-economically, if we look at the entire, the genomic data of the entire country, I'm sure we'll be surprised to find how heterogeneous we are. In terms of our occupations, if you go and look at women artisans who might be working with some chemicals in some rural population versus a corporate woman sitting here in Delhi, their genetic makeup would be completely different. A, by birth, and B, by the kind of exposure they have been through. And sadly, they don't even know that they are being exposed to certain chemicals. Similarly, like we did a project where we did compare the BRCA data of northeastern population with North Indians. It was different. So it makes us decide the treatment protocols differently. While we are relying on the guidelines, on the genetic makeup of the standard data or the softwares which are there currently because of the data being available only for the Caucasian population right now. So I think that's where we are as a country lagging behind, and we have immense technological expertise, we have immense scientific expertise, but we are not unable to utilize it because of cost. It's not possible for everyone to get a genetic test done. We sitting here are from the cream of the population, so it's easy for us. But it's not possible for everyone to get it done. Let's be frank. There may be every awareness. Every human may become very proactive and everything, but it's not possible today for everyone to get it done. I think that's something we need to put our attention to. In terms of predictive medicine, also. Because I believe because BRCA has become a very, I would say, glamorous thing today, we know about it.
Do you want to tell everybody what BRCA stands for?
Yeah, so BRCA is basically a gene which is most commonly mutated in a genetic breast cancer or a hereditary breast cancer. Apart from breast cancer, it is also associated with ovarian cancers, pancreatic cancers, prostatic cancers. But when we talk about genetics, we are not only talking about BRCA. It's a very important part of it, but a very small portion also. We are also talking about that we need to be more concerned about the other chronic diseases as well, like cardiovascular diseases or diabetes or neurodegenerative disorders, wherein if we find a high risk factor in a certain population, there are proactive measures which can be taken to prevent, or just simple lifestyle modifications can be done. Like Sir had mentioned, just simple lifestyle modifications can be done to prevent those diseases. If it's a genetic disease, how much ever physical exercise we do, if a cancer has to happen because of genetic reasons, it will happen. But we know what we are dealing with then. So we can target those cancers accordingly by treatment strategies. And there's just so much more. There's just plethora of things which we can do based on the data, not just genomic data, but by integrating the entire data of imaging, clinical opinion of a clinician, and epidemiology, and of course genetics and other lab tests. So I think there is a lot to do, lot which can be done, and I think we are a very data-rich country. We are just not utilizing it.
Brilliant. Meaning, how much time do you can't just watch TV all the time. How do you inspire children to and adults and older people to exercise more?
As we are discussing women health and
सर आज यहाँ पहुँचे महाजन लाइब्रेरी, किस तरीके से क्या करेंगे, इसकी अवेयरनेस अभी भी नहीं है?
Sports is the only thing I would say. Awareness, look after yourself. वो सबसे बड़ी बात है. Technically I can't answer because मुझे इतनी knowledge नहीं, इतना ज्ञान नहीं है. लेकिन अगर आप अपनी सेहत को ध्यान रख सकते हैं, 90% cure is there.
किस तरीके से देखते हैं आज जिस तरीके से महिलाएं हैं रूरल एरिया में अभी भी जानकारी नहीं मिल पा रही, और आपने कहा कि हेल्थ के लिए जरूरी है निकलना लोगों को घर से बाहर निकलने के लिए?
बिल्कुल निकलना चाहिए, ये मुझे लगता है. मैं चाहता हूँ कि हाँ, कहना बड़ा आसान है, करना बहुत मुश्किल है, वो भी मैं जानता हूँ. लेकिन अगर आप अपनी सेहत के लिए नहीं कर सकते तो किसके लिए करेंगे? हम ये नहीं कहते कि दूसरे के लिए कर सकते, अपनी सेहत के लिए बाहर जाइए, थोड़ा वॉक कीजिए. इट्स जस्ट अ गुड हेल्दी लाइफ इज़ वेरी इंपॉर्टेंट. वही आपकी कंट्री को स्ट्रेंथ करता है, स्ट्रेंथन देता है. सो आई थिंक इनका एजेंडा और माई एजेंडा इज आई वॉन्ट एज ए स्पोर्ट्समैन लोग बाहर निकले, 24 घंटे मोबाइल पे ना रहे. बच्चे जो आजकल के हैं 24 घंटे मोबाइल पे रहते हैं. प्ले ग्राउंड में जाइए, कुछ कीजिए, उससे आपका बेटरमेंट है और कंट्री का बेटरमेंट है.
Sir, on India winning the Champions Trophy.
Very good.
My question is still not addressed.
Something also.
Very good. I mean, very good. Say excellent, fantastic, and proud of my team.
Sir, on roads
Awareness, educate, and focus more on prevention of disease rather than on treatment. If we are able to actually catch a disease early, be it cancer, be it heart disease, be it diabetes, then we are able to treat it much better, and the side effects and the problems associated with the disease are much lesser. Also, our focus is on integrated diagnostics, where blood tests, X-ray, ultrasound, CT, nuclear medicine tests, genetic tests, they are all done in a manner that they don't remain in silos. They are integrated to reach the final diagnosis as quickly and at as cheap rate as possible, without doing extra testing, doing the appropriate testing so as to be able to reach the final diagnosis. Because today, in the era of evidence-based medicine, without testing, treatment is not started, and especially for serious illnesses, you need treatment, and that's where personalized treatment, personalized health checks are becoming very, very important.
Thank you. सर, कितना जरूरी है आज की डेट में महिलाओं को जागरूक होना कैंसर के प्रति देखा जाए तो?
जहाँ हम सक्षम भारत की बात करते हैं, वहाँ स्वास्थ्य बहुत आवश्यक विषय है, और स्वास्थ्य में भी महिला स्वास्थ्य एक बहुत ही महत्वपूर्ण विषय है जिसके प्रति सभी को जागरूक होने की आवश्यकता है. महिलाएं पूरे परिवार के स्वास्थ्य का ध्यान रखती हैं, पर कहीं ना कहीं वो अपने स्वास्थ्य का ध्यान नहीं रख पाती हैं. इसीलिए स्वास्थ्य से संबंधित जितने विषय हैं उसके प्रति जागरूक होना और फिट रहना, ये जहाँ महिलाओं के लिए इम्पॉर्टेंट है, वहीं महिलाओं के स्वास्थ्य की चिंता करना हम सबके लिए बहुत इम्पॉर्टेंट है. क्योंकि अक्सर ये देखा जाता है कि महिलाएं अपने रूटीन में सबके लिए सोच विचार करती रहती है, लेकिन अपने लिए नहीं कर पाती है। तो मुझे लगता है वी फॉर हर जो कार्यक्रम आज यहाँ रखा गया, इसमें हम सब महिलाओं की स्वास्थ्य की चिंता करें, इस विषय को हाईलाइट किया गया है। और मुझे लगता है ग्रामीण क्षेत्रों में, शहरों के क्षेत्रों में भी अवेयरनेस ड्राइव करने की बहुत आवश्यकता है। और यंगर जनरेशन में, लड़कियों में स्वास्थ्य से संबंधित अगर विषय को हम सही रूप में ले जा सकें तो मुझे लगता है वो भी अपने परिवार में स्वस्थ समाज और परिवार बनाने में अपना योगदान दे सकते हैं।